Good morning everyone, my name is Dr. Purudhavan and today I will talk about millets and its effects when consumed by a chronic kidney disease patient. As a doctor, I often get questioned about the consumption of the various food items, particularly by the kidney patients. As diet play an important role in the treatment line for a CKD patient, it is important to check what is being consumed on a daily basis. One question I want to address today is whether it is beneficial for a kidney patient to switch from rice, wheat to millets. In simple language, millet are coarse grains consumed throughout the Indian subcontinent, widely known as ragi and bajra. Millets have an extremely low carbohydrates content in them as compared to the wheat and rice. Therefore, it is an excellent choice when someone wants to lose those extra pounds. In a chronic kidney disease patient, it is advised to keep a check on the body weight due to the complication that can arise. With this, another beneficial component of millet is its nutritional value, which is higher than wheat and rice. Therefore, if a CKD patient replaces their wheat and rice consumption with millet, changes in their physical appearance can be seen in terms of weight loss. This weight loss, however, should not be accompanied by the weakness in an individual, which would not be a positive sign. Let me explain. If a CKD patient only consumes a diet that consists of boiling vegetable like bottle gourd, it is extremely harmful in terms of health. With chronic kidney disease, only the kidney in the body are affected in terms of functioning. But the other organs in CKD patient work to their full capacity until the disease does not start to affect them. One way by which the other organ might get affected in a CKD patient is when a proper diet is not consumed. By just eating boiled food to improve kidney functioning, the organs ends up not receiving the essential nutrition that are important for them to function well. This is accompanied by the added pressure that the weak kidney put on the other organs, often pushing the body towards a multi-system failure in certain situations. Therefore, every kidney patient should keep in mind always to maintain a proper diet so that the body can receive the required nutrition. With this, anemia can be another complication in a CKD patients who do not consume a proper diet. In simple terms, anemia is a condition where the body does not produce enough RBC, resulting in a low blood levels. This condition alone is a big health issue as certain important elements such as protein and folic acid do not reach the body in a proper amount. Low blood level are extremely dangerous in a human body, which can result in patient being artificially administered blood through veins due to the severe symptoms such as weakness or shortness of breath. Therefore, it is my advice for all CKD patients not to let their body get weak internally, as this will only increase the number of complications to deal with. Often patients are very concerned about the increasing level of creatinine and urea in their bodies. Both these waste material accumulate when the kidney do not function properly due to the disease. Creatinine is produced in the muscle of our bodies. One prominent change in the body weight is whenever a CKD patient consumes only boiled vegetables. This is due to the body losing muscle mass, bringing the creatinine level down. But during this process, one thing remains the same. The kidney keep getting damaged, and with this, the creatinine level starts to rise once again in the blood. But with the increase in the creatinine level this time, the body is already weak, thereby making the symptom severe. This can range from the patient being unable to walk or stand and even to a point where a dialysis is not possible anymore. Therefore, it is not advisable to follow a diet that is not balanced, as it may get your creatinine level down temporarily, but the kidney won't heal in a long run. Ultimately, the creatinine level will start to increase in the patient, which will be severe in nature. Therefore, I advise all my viewers not to go for any temporary treatment, but to find a permanent solution. As we know that the high blood pressure and the sugar are the two main causes of chronic kidney disease. Both of these affects the kidney in a long run by reducing the flow of proper oxygen and blood. By controlling the level of blood pressure and sugar, the level of damage caused to the kidney can be reduced to a great extent. I always advise my patient to keep their BP and sugar levels normal, as this small step can make a big difference in the life of a chronic kidney patient. So now let's back to the millets. Millets are good for a CKD patient if the patient body weight is high. And if you are underweight or you are medium built person, then millet diet is not advised, because if we consume millets in a high amount, you will lose the body weight, which is not advised at all. So depending upon your body type, you can take millets, you can take wheat and rice. So I hope with this video you have understand the benefit and the disadvantage of millets in a CKD patient. Now that we have reached the end of today's video, I hope all of you understand the benefits of consuming millet in a chronic kidney disease patient. With this, it is important to have a balanced diet to keep the flow of essential nutrition to the body. If you have any doubt regarding the video, feel free to comment in the section below, and I will be more than happy to reply all of them. With this,